All right, so here we've got an erect AP chest radiograph. And the first thing that really stands out to me is that this is a skeletally mature patient. What immediately catches my eye is that there's a pretty significant loss of lung volume in both lungs. But what's most interesting is this dense calcification on the left side of the chest, specifically in the left hemithorax. It extends laterally from about the 6th to the 10th ribs. And honestly, when I see something like this, I'm already thinking pleural plaques, especially calcified pleural plaques, which are a hallmark of asbestos exposure. Looking more closely, I notice that the calcification is relatively well defined, and there's this other opacity that's projected more medially, which further supports my initial thought. Everything about this really suggests calcified pleural plaque disease. This kind of pattern is very consistent with pulmonary asbestosis. Now, as I keep reviewing the image, I'm also seeing increased interstitial markings bilaterally, particularly in the lung bases. This really aligns with a fibrotic lung disease with a basal predominance. Given these findings, I'd say pulmonary asbestosis is my top differential here, especially if we have a patient with a history of occupational exposure, think something like shipbuilding or construction. When I consider the entire picture, it's pretty clear that this patient, who is 81 years old, is dealing with pulmonary asbestosis. The calcified pleural plaques, combined with the basal fibrosis, are very telling. Now, just a quick reminder, the plaques themselves don't necessarily mean asbestosis on their own, but when you pair them with this pattern of fibrosis, it's a strong case for it. So what's next? I definitely want to order a high-resolution CT scan to get a better look at the extent of the fibrosis in the pleural plaques. A respiratory referral would be important too to further manage the case. And if this is the first presentation, I'd want to review any prior imaging to see if there's been any progression over time. Now, thinking about the exam, you might be asked about the key radiographic features of asbestosis, or even how you differentiate this from other lower zone interstitial lung diseases. I'd focus my answer on the presence of pleural plaques, the symmetrical basal fibrosis, and the occupational history, which are all critical points. You'd want to highlight how this differs from conditions like idiopathic pulmonary fibrosis or lymphangitis carcinomatosa, which can sometimes present similarly but have different causes or patterns. So to wrap it all up, this is a classic case of pulmonary asbestosis, with those characteristic calcified pleural plaques and lower zone fibrosis. The next steps would definitely include high-resolution CT and a referral to a respiratory specialist. Oh, and hey, if you found this case breakdown helpful and you're looking for more radiology content that's easy to understand, make sure to subscribe to Radiology Made Easy. I've got plenty more cases coming your way, and trust me, you don't want to miss them. Hit that subscribe button, tap the bell icon, and let's make radiology, well, easy. See you in the next case.